NewsRme. The White House scrambles to respond to the outbreak of monkeypox. Administration officials have admitted that they must increase their efforts since the number of illnesses has increased more rapidly than anticipated. Washington. The Biden administration is revising its approach to the epidemic of monkeypox following weeks of logistical and bureaucratic delays in delivering tests, treatments, and vaccinations. According to administration insiders, Biden administration officials recognize they are now playing catch-up as the number of illnesses has increased from dozens to thousands in a very short period of time. As part of its new plan, the government is trying to dramatically increase the number of people who get vaccinated against monkeypox and make it easier for those who have it to get an experimental treatment, as well as designating a monkeypox coordinator to manage the White House's response across agencies and with state and local governments. According to a dozen frontline physicians and former public health officials who talked with us, the administration still confronts a labyrinth of impediments. Julie Marita, who advised President Joe Biden on COVID during the transition and directed the Chicago Department of Public Health for over 2 decades, said, "I believe we still have the capacity to continue to manage this. It's just a question of acquiring the resources. Public health must be appropriately funded, the vaccination supply must be raised, and communication efforts must be intensified. All of them, however, are possible and might lead to the containment of this pandemic." It's not too late, remarked Marita. This week, a number of states, including New York and California, declared public health emergencies, while the Centers for Disease Control and Prevention recorded illnesses in all states but 2. The average number of new cases recorded each week jumped from 45 on July 11 to 214 2 weeks later. Since the beginning of May, the United States has documented roughly 6,000 cases in total. The global total surpasses 20,000. As the virus is now spreading almost exclusively among males who have sex with other men, the administration's plan has mostly centered on vaccination. The highest risk people, such as those who have had many male partners in the last 2 weeks, are those who have been exposed. Recently, though, administration officials have advised other males who have sex with men to reduce high-risk behaviors, such as having several partners, until the epidemic is contained. They are aiming to disseminate this information to the homosexual, transsexual, and bisexual communities through dating apps, events, and involvement with community leaders.